Are we good to go?
We're good to go. Yeah, we're waiting for the countdown. You just finished the countdown.
Yeah, sounds like launching a rocket to space.
Okay, live.
Are we good to go? Are we good to go?
Yes, sir, we are good to go.
Thank you. Colleagues, thank you very much for your time and for what you're doing. You know, this week there is this very important Africa Union EU summit in Brussels. I think one of the most important summits we'll have had for a long, long time. The last one was in Abidjan, of course. And in that summit, there'll be many things to discuss, including green transition, financial development, security, migration, and so on. But one of the things which focus the attention of the summit is what it takes to bring back Africa to the recovery path. And so I'm happy that we are here today to discuss that in the health financing. I'm glad we have got organization leaders who are very knowledgeable on this issue. Winnie is no introduction, head of UNAIDS. Good to see you, Winnie. Peter Sands, head of the Global Fund. Remy Rioux, my friend, I don't know if he's there, from the Agence Française. And our friend Ziakono from UNDP. And finally, Yari Negash. But you also have a very important sponsor, Stéphanie Seydou, board member of the Global Fund, and also co-sponsor of this event. And so before I make my opening remarks, I want to give Stéphanie a chance to say a few words. Then I'll make my opening remarks. Then I'll hand over to the panel. We need 1 hour, after which we shall go to the next session, which will come in after 60 minutes. So, Stéphanie, you have the floor, please. Stéphanie, you're muted. You're muted. Stéphanie, you're muted. Yeah. We can hear you now.
Oh, hi. Can you hear me?
Yeah, we can hear you now.
Yeah, sorry, I was desperately fiddling with my mic. Dear Dr. Kaberuka, dear Donald, Executive Director of UNAIDS, dear Winnie, Executive Director of the Global Fund, dear Peter, Director General of the Agence Française de Développement, dear Rémi, Executive Director of the Africa CDC, dear John, ladies and gentlemen, speakers and participants, good morning and good afternoon to all. I am quite delighted to be with you today to open this event, which marks the beginning of the Africa-Europe Week in the perspective of the important European Union, African Union Summit. As you know, France currently holds the presidency of the Council of the European Union, and we are very glad to be a sponsor for this side event as we fully share the objectives that bring us together today. We will continue to send clear messages to the international community, to international organizations and multilateral funds such as the Global Fund, UNITAID, Gavi, and to ourselves with concrete results to be observed and achieved. The COVID-19 pandemic has created a tragic opportunity to revise our thinking quite fundamentally about strengthening health systems effectively, and therefore about better reshaping resource mobilization in health, including domestic health resources, in the continuation of commitments made, for instance, by the African Union in Abuja to devote 15% of national budgets to health. And indeed, during my last trip to West Africa, it was on the occasion of the UNAIDS conference in Dakar in November, I heard ministers of the sub-region who all defined strong political and financial priorities for health and had a very clear vision of the importance of mobilization of domestic resource. So clearly there is a dynamic, and I think we can bring about important changes in order to achieve our goals. We must take advantage of this momentum. We know that strengthening health systems is the best way to achieve universal health coverage. And we know that it is a prerequisite to end HIV and response to future pandemics. And therefore, there is such convincing global case to invest collectively in health systems, from prevention to equitable access to treatments, as well as local production improvement, quality person-centered care, epidemiological surveillance, and data collection and management. For all this, regional and international partnerships must be encouraged. And I'm thinking in particular of the collaboration between regional, African, and European institutions, which have shown their effectiveness. And we will hear in the course of this week about the mRNA hub in South Africa, the Institut Pasteur in Dakar, Senegal, and many other very promising projects, such as cooperation between the African Medicines Agency and the European Medicines Agency, and of course between CDC Africa and ECDC. Beyond that, the international development and financial system must be mobilized more effectively to invest in health. We have the IDA 20 reconstitution, which was finalized in December within the World Bank, a very important event. Evolutions also on the special drawing rights reallocations to the Poverty Reduction and Growth Trust. Indeed, the evolution to the future IMF Resilience and Sustainability Trust and other revolutions within the IMF, ideally also the World Bank and other regional development banks. And we know that important discussions are currently underway within the G20 and in other fora, as well as at the board of the IMF in this respect, and they must be followed very closely. Our attention must also be focused on human resource, which have not been given their due value. And we must increase our efforts by improving first initial and ongoing training, and the WHO Health Academy will play a crucial role in this area. Secondly, adequate and sustainable salaries, including for community workers. And finally, working conditions for health workers who are in the front line and 70% of which are women. And a sobering figure, which is that the financial value of unpaid women's contribution to the global health system is estimated at 2.35% of the world GDP. And this is a source from the WHO report delivered by women, led by men. So that is about $2,000 billion over the past years. For several years now, France has highlighted the multiplier effect of change policy in the fight against gender inequalities in the health sector, with a triple dividend in terms of 1, benefits for health systems, 2, equality between women and men, and 3, economic growth. Now, this is really a direction which is extremely promising and in terms of returns, and we must really invest in that direction. Human resources, among many others, is a point my colleague Rémi Rio will certainly develop in a few minutes. And indeed, France and the Agence Française de Développement are much involved in the support to health institutions, to health system strengthening, to general investments in the health sector in Africa. And Rémi will go over this, I am sure. Now, thank you very much. Once again, France is delighted to be a sponsor for this important event. I wish you fruitful and successful discussions. And I will now return the floor to Dr. Kaberuka. Thank you so much.
Thank you very much, Stephanie, for those powerful remarks. Again, I'm very glad that you, France, as chair of the EU in the 6 months, you have been able to sponsor this event. Thank you very much for that. Now, I have just 4 points to make to frame this conversation, and I will not be long. First point I want to make is the following: that contrary to what people think, many African countries were not actually doing very badly before COVID. That is even in spite of the global financial crisis. With issues of unemployment, yes, lack of transformation, inequalities, poor safety nets, and a number of countries had huge macroeconomic vulnerabilities. But for the first time in 30 years, a real per capita GDP growth was positive in many African countries. That is not to say there are not many problems, including the ones I've just mentioned. Yes, there were, let alone issues of fragility in places like the Sahel and the Horn of Africa. Now, here comes COVID, which is the first major shock in 10 years, coming after the global financial crisis. Comes 2020, which is the worst year in 30 years. Fiscal space has shrunk everywhere, and we are now off targets than even before COVID. But something has happened during this crisis, which is all described in the documents, that actually direct expenditure on health has doubled during the COVID period, from an average of 8% to about 16%. But I'm not discussing here issues of intrasectoral efficiency in spending, or even the outcomes. I'm talking about the broad number, from an average of 8% to 16%. But it has come at the expense of other important things. That is important point I should make. There's been a substitution effect, right? Not an additional effect, a substitution effect. And therefore, as we recover from this drama, and that's my second point, the following factors will determine the recovery of the African economies. Number one, the path of the virus. I see that around the world, especially in countries which are vaccinating many of their people, there's beginning to be the talk of the end of COVID. I hope they're right. But the path of the virus in many parts of the global south will be the major determinant of what happens to our economy. Second, the rate of vaccination, still below 10%. Still below 10%. In many countries, even below 7%. That is the second factor. And I should add here, building what Stephanie has just mentioned, that we could see a correlation, a direct correlation between ability to deploy vaccines and resilience of the health systems. Countries with fairly reasonably robust health systems have been able to deploy the vaccines. Those who don't have those primary healthcare systems have not been able to deploy the vaccines. We can see a link, and that will be a major consideration for us in the future. The third factor will be our ability to repair the damage done around the economies and social fabric during this crisis. You know the extent damage from trust, social safety nets, underemployment, under-utilization of capacity, that kind of stuff. And that includes the lost space we have had on all the pandemics. So our ability to catch up and repair that damage will be critical. And the last two, not surprising, will be the trajectory of the global economy. It's amazing how this disruption in the global supply chains have quickly hit some of the low-income countries just at the wrong time. And I do believe that our ability to figure out what to do will be one of the key factors in returning our economies to growth. And finally, the multilateral response. I've said before, and I repeat it here, that the response of the multilateral system has been very asymmetric. Some institutions have done very, very well. You will not be surprised to hear me saying this. I think the IMF has been the global leader on this, under the leadership at the moment. Other organizations have done very well. Our own organization, the Global Fund, has done extremely well within its own mandate to try to secure its current mandate, but contributing to this pandemic, which is COVID. So the multilateral response, some of which Stephanie has described, will be critical. And we look forward to the summit in Brussels on Thursday and Friday to say exactly what that would look like. And my last point is the following. Building primary health systems which are robust can actually be done very cost-effective. Very cost-effective. You know, health workers, minimal community insurance schemes, leveraging technology. Often when we talk about building health systems, we think we're talking about billions of money. We don't need billions of money, but above all, we need political commitment and countries working together on this issue. And I want to end here by saying to you, colleagues, that African institutions are often decried for not being very effective. I look forward to listening to John Kengason, because I think in this crisis of COVID, actually Africa has done, in terms of organization, much better than many other parts of the world. I know this sounds very counterintuitive because of what is known and said about Africa globally, but Africa CDC has been a landmark. So has AVAT as well. So has the medical platforms. And so as we create this new landscape, it will be very important to agree on what to do to strengthen African institutions themselves, like Africa CDC, Africa Medicine Agency, Africa Platform, AVAT, because they have demonstrated that in a dysfunctional multilateral system, it's possible to create African centers of excellence, which provide a part of the answer to the response. So I look forward to hear from you, from Winnie, Peter Sands, Remediu, Isakono, and I hope we can do so in 1 hour. So without further ado, I'll give you the floor, Winnie, and good to see you.
Thank you, Donald. And it's such a pleasure to be among these distinguished panelists. Let me start by thanking the African Union and the government of France for joining UNAIDS to convene this important dialogue. The sense of unity and purpose that brings us together is remarkable, as is the need for urgent action to change course, as Africa indeed has been left behind during this COVID crisis, with unprecedented impacts on poverty, on gender equality, and on the health of our people. Africa, with 16% of the global population, 26% of the global disease burden, accounts for only 2% of global health spending. Despite the Abuja commitment of 2001 by governments to allocate 15% of their budgets to health, the average today is only 7%. With COVID, that shortfall has been exacerbated. Fiscal constraints have increased, and debt repayments are a huge and immediate threat for many countries. African recovery is uncertain, as you have outlined, Donald, and inequalities have vastly increased. With an average COVID vaccination rate of just under 12%, as you've said, how can the region aspire to a speedy normalization of its economy? And since March 2020, high-income countries have deployed over $17 trillion to protect themselves from this crisis. The solidarity expressed through ODA increased by just 15 billion. Meanwhile, debt relief has only been minor and temporary, and private creditors just stepped aside. But like you, Donald, I want to highlight the very positive African leadership that has been demonstrated since the very beginning of the COVID crisis. The multilateral response may have failed us, but African leadership has been remarkable. We welcome that Africa CDC, with us here today, John Kengason, has just been established as an autonomous health agency and recently launched the partnerships for vaccine production in Africa. And the newly created African Medicines Agency will allow our continent to harmonize its regulations, to negotiate joint purchasing, and to manufacture its own medicines. And I'm on a high because this week, South Africa did it again by developing its own version of the mRNA COVID vaccine, which is going to be tested in the coming months. This in spite of the monopolies, the hiding of this technology, but using the information publicly available, has come to produce this vaccine within 2 years. Progress against the AIDS pandemic, which was already off track, is now under even greater strain as the COVID crisis continues to rage, disrupting HIV prevention and testing services, disrupting schooling, violence prevention programs, and more. All of this, which will worsen the outcomes in our work. If we continue as we are, if we do not take the steps necessary to speed access and close inequalities in the HIV response, listen to me, the world could face 7.7 million AIDS deaths over the next 10 years. 7.7. And 4.7 of these million of these deaths would be in Africa. But if we make the needed investments and achieve the 2025 targets which we set, we could save 2.7 million lives. Financing is critical to contain and reverse this negative trend on AIDS, to strengthen and upgrade health systems and prevent future pandemics. It's clear that we shouldn't have to choose between ending the AIDS pandemic today and preventing the pandemics of the future. The only successful approach will be to achieve both. The investments and approaches needed to tackle AIDS are the most effective to prevent future pandemics. But it is a pity that in global circles, that these two are now being debated as if they are two separate agendas. We need to bring them together. We need increased domestic investments, but the numbers are bleak and recovery will take time. Africa needs to move towards the Abuja Declaration threshold and also needs to increase domestic revenues as a whole. That requires economic growth first, domestic tax reforms, and faster global policy change to prevent tax evasion. It's hard to increase domestic public investment with losses to tax dodging in Africa ranging from 25 to 50 billion US dollars per year. This is data from Tax Justice Network. With all those shortfalls, global solidarity needs to grow in this decade, with the target of 0.7 still needed as much as ever. And the EU and its member states need to take the lead. Support to strengthening African institutions for public health will be most essential. The Global Fund 2022 replenishment is a critical milestone and requires strongest support. And I'm happy to join forces with Peter Sands in this very special year. Other sources of financing must be activated too and repurposed to invest in health, such as the SDR reallocation. And any other resources that would be freed up from debt. These must also be directed to strengthen our health systems and fight pandemics. Also, any other concessional and blended instruments that can be mobilized. The existing G20 common framework for debt relief is not sufficient. More robust mechanisms to avoid debt traps for African countries are needed. Yes, Africa needs roads, needs bridges, needs jobs. Africa also needs an educated and healthy population. This has also to be at the same level of priority as infrastructural investments. Financing must come hand in hand with global policy change for a faster recovery, and that means enabling equal access to health technologies and increased local production in Africa. We are witnessing the same deadly mistakes today as those that were made when treatment for HIV became available. When HIV treatment costed $10,000 per person per year, a price far out of reach for the millions of people living with HIV in the global south, and that between 1997 and 2006, 12 million Africans died because the medicines were priced out of reach, and pharmaceutical monopolies were just reaping billions. It's completely immoral that leaders are continuing to defend the profits and monopolies of their pharma companies instead of sharing the successful vaccines and the technologies that should scale up production worldwide. Let me finish by reminding ourselves two key ideas. The first is that economic recovery will not happen without health security. We've learned that. They go hand in hand. The second is that African people have a right to health like all other people in the world. And financing is one means to ensure that that right is realized. Financing, therefore, is a high priority for African political leadership. It should be a high priority for global solidarity, and it is also a matter of justice. Thank you. Back to you, Donald.
Thank you, Winnie. Thanks so much for the powerful statement. And thank you for what you do at UNAIDS. And thank you for your kind words about the replenishment of the Global Fund this year. It will be a pleasure indeed to work with you on this. That's very common undertaking. I'll now give the floor to Peter Sams. Peter, you have the floor.
Thank you very much, Donald. And can I start by saying what a pleasure it is to be on a panel moderated by you as the chair of the Global Fund and a leader in Africa, and with such great colleagues and friends. France is the second largest donor to the Global Fund. The European Commission is the fifth largest donor. UNAIDS, the World Bank, UNDP, WHO, AfD are all fantastic partners working with us in many different countries across the world. And of course, it is wonderful also to have a representative of the youth, because so much of what we're talking about is rooted in communities, and particularly young communities, and they have so much to bring in terms of making the changes required, but they're also so affected, particularly by diseases like HIV. Before COVID struck, much of the discussion around the interaction between health finance, and economics was one way. It was largely about how do we get more money for health. And although some health economists and people in the health world would talk about the economic impact of health issues, frankly, that didn't get much traction in the worlds of treasuries, bankers, businesses, and so on. And actually, we were not as successful as we should have been in getting more money for health. As Winnie said, the Abuja Declaration about having 15% of government expenditure to the health sector was not actually consistently achieved by any country in the region before the COVID crisis. And indeed, between 2001 and 2018, although 23 countries increased their spending on health in Africa, 19 reduced theirs. So before the crisis, we hadn't really won the argument that investing in health delivers broad social and economic benefits, such as to make a difference in the amount of investment. But if we ever wanted a powerful lesson on the interaction between health issues and the economy, COVID-19 was that lesson. It has had a massive impact on economies right across the world and continues to have a significant impact. Indeed, one of the most powerful things we could be doing to improve the global economy, and particularly the plight of the poorest people, is to end this crisis as quickly as we can. And there is a risk that the approach that we may be drifting towards now, which is sort of declaring partial victory in some places while not actually winning because this virus continues to evolve, and we need to expect new variants, and there's no automaticity to the idea that these will somehow be less virulent. There's a risk that actually we end up perpetuating a crisis and causing long and deep scars in economies and communities across the world. So we need to end the crisis, and that means investing in the requirements to beat COVID-19 as quickly as we can for everywhere and for everyone. And that's why things like the ACT-A financing framework that was launched last week are so critical. It's critical that we put the resources into beating COVID as quickly as we can. We also need to get better at protecting against future pandemics. And that's all about systems, people, infrastructure that allow health systems around the world, public and primary health systems, to respond flexibly to new threats. As somebody, I think, put it quite powerfully, new infectious disease outbreaks are inevitable. Pandemics aren't inevitable. They're a choice, and they're a choice we can choose to avoid. But while COVID-19 has taught us a lot about the downsides that health crisis can bring, I think we still underestimate the upsides from getting rid of health issues. Whole communities across the continent are blighted by infectious disease, whether it's communities blighted by high incidence of HIV, which causes death, ill health, but also significant financial burdens for the health system. Or malaria, which holds back the education, labor productivity in many rural parts of the continent. Or TB, which typically affects people at the prime of their working life, often breadwinners for poor families. The prize of getting rid of these diseases is as great as the downside we have seen happen with new pandemics like COVID-19. And that's why sustainable increases in investment in health are absolutely critical. And it's great, actually, that the African Union, with the ALM initiative championed by President Kagame, has taken such a lead on driving approaches to getting more sustainable leadership, more sustainable financing of health across the continent. But we also need significant external support. And indeed, some of the partners on this panel are critical players in providing external support. The Global Fund has its role to play, particularly around HIV, TB, and malaria, and health systems. And this year, as Winnie said, is a crucial year with the 7th replenishment of the Global Fund, which President Biden has agreed to host in the United States in the autumn. The needs to fight HIV, TB, and malaria have increased as a result of the crisis. We have a deadline, a commitment to end these 3 diseases as public health threats by 2030. Yet in the last couple of years, we have gone backwards or stalled in important dimensions of the fight across all 3 diseases. On HIV, we actually did better than many people feared, working as partners, as communities, in keeping people on antiretroviral treatment. In fact, in 2020, the number of people in antiretroviral treatment actually went up. But prevention has suffered. Prevention has not achieved what we wanted to achieve. And the numbers of people getting tested or enrolling on new treatment has fallen. So we must reverse those trends, and that will take more money. So a successful global fund replenishment this year is a crucial step to ensuring that health across the continent gets the financing it requires. And it's not just about the fight against the three diseases specifically, but it's also because the Global Fund is such a large provider of support to investments in health systems, and particularly primary and public health care systems. But whatever the external support provided, whether it's from the Global Fund, the World Bank, AFD, or others, ultimately the key to sustainably protecting everybody from the deadliest infectious diseases, whether those we're facing right now, such as HIV, TB, malaria, and COVID, or those that are around the corner, is through domestic financing. And that's where the political leadership around tax, budget priorities, and so on are so critical. And it's also about how you spend money in health. It's about making sure that primary healthcare and public healthcare get the priority and attention they deserve, because so often, and this is true in countries around the world, however rich they are, more money than is rational gets diverted towards tertiary healthcare, and very much for the elites. So we need to ensure that the healthcare systems that Africa invests in are those that reach everybody, truly leaving no one behind, and put that focus on the primary healthcare and public health. I'll close by just echoing my dear friend Winnie's remarks around the need to avoid a false distinction between our older pandemics, HIV being the obvious example, and the current pandemic, COVID-19, and the future pandemics that we will inevitably face in the future. For one thing, they are all pandemics. It's just that some of these pandemics are no longer killing large numbers of people in rich countries. But that's no reason not to call them a pandemic, and it's no reason not to respond to them as a pandemic. Secondly, the things that we need to do to combat them are the same. It's trained health workers. It's laboratory networks. It's disease surveillance systems. It's supply chains. It's the same components of the health system that enable you to fight a disease like HIV, fight a disease like COVID, or respond to the next infectious disease outbreak. And that's why we must approach this in a way that maximizes the ability of health systems to both combat the existing threats and prevent, detect, and respond to new threats. And that does require sustainable financing and really thoughtful prioritization. I also just want to echo briefly Stephanie Sidhu's emphasis on people. When it comes down to it, building a sustainable health system does involve sophisticated equipment, molecular diagnostic instruments, gene sequencing, logistics systems, but actually ultimately the core of any system of health are trained, motivated people. And I think we sometimes underestimate the positive side of that. The climate change world talks about green jobs so that people don't think of the need to employ people to affect beneficial environmental change as being a downside and an expense, but as a benefit. In the same way, the jobs that are created through building more viable, more resilient, stronger, and more inclusive health systems are themselves a benefit. They're great jobs and themselves are an engine of development. So with that, I'll close and say this, I think, is a key moment for health, not just in Africa, but everywhere in the world. We should take COVID-19 as a catalyst to rethink the importance of health, the importance of giving everyone the right to health, and of building primary health care and public health systems that can truly protect everyone everywhere from the deadliest infectious diseases. Thanks, Donald. I'll hand back to you.
Thank you very much, Peter. Thank you for what you have said and for your leadership of the Global Fund in recent times. I will now call on my good friend Remy Riou. I can't see you, but hope you are there. Remy Riou, head of the Agence Française de Développement.
Yes, I'm here, Donald. Can you hear me?
I can hear you very well, Remy. Please welcome.
Great.
Good to see you. Good to see you.
Excellent. Thanks a lot for the invitation. Donald is forever my boss, and I'm very honored and pleased to be on this panel with Stephanie, Winnie, Peter, Hauna, and many distinguished colleagues to come. I know John and others. It's because this discussion is so important, touching the heart of the development agenda, and putting into question, of course, our respective mandates after 2 years of this COVID-19 pandemic that has interrupted the trajectory of progress towards the SDG. So I think this AU-EU summit is a perfect place and timing, well, to take stock of where we stand and measure what we have done well. And I think what the African Union did is fantastic, but also measure our frailties and be the wake-up call we need to do better in the future. Three lessons maybe from my side after these 2 years. First, of course, we have to recognize, we all did, that health systems did not benefit the right level of investments. Globally, of course, in each and every country, and specifically in Africa. Especially the intrinsically set of actions that can protect us from existing and future health threats. Spending on health has declined as a priority in African budgets over the past decade, meaning households pay more and more on health care. Since 2000, there has been little progress in health systems capacity on the continent. Less than half of the clinics in Africa have water and electricity. And the shortage of health workforce is massive, about 6 million professionals. So we have to do way more, and we know where is the funding gap. I mean, the funding gap is in investments in health, human resources, and infrastructure for 70%. So the direction is quite clear. And we also probably, us as international institutions, have to recognize also that we have a serious issue in substitution effect. You said it, Donald. And so imagine a system where we have traction on national systems rather than substitution in national budget. So that's for health. Of course, most countries also lack strong social safety nets, more broadly speaking. And to face the sanitary and now the economic shock, we need to make progress towards universal health and social coverage. And many countries have not yet developed the national institutions that allow to pool financial resources and organize social protection at scale to protect, of course, the most vulnerable segments of their societies. Last, my third lesson, also true in Europe, in America, in Africa. It's not specific to Africa. And Peter said it. We have to change the way we consider the health sector. Of course, this is now nurses and doctors are the most precious resources in the world. And we're missing them dearly. So we have to consider the health sector as a dynamic sector of employment and economic growth. I remember it was said by France and South Africa a few years ago. There was a commission on this. We know the health sector already represents 10% of global GDP, maybe more now, and contributes critical economic values to the world economy, both in terms of industry and services, and the potential of this industry, of this healthcare sector, to provide jobs, good jobs for women, for youth, in both rural and urban areas, is still largely untapped. So that's for the situation. A few words on the perspective and what hopefully will be at the heart of the discussions in Brussels at the end of this week between our leaders. First is we need to reorganize the way we manage the health commons at national, regional, and global levels. There were a lot of discussion, especially last year at the G20 and beyond at the UN level on this. Of course, we need a strong multilateral capacity, but we also need regional pillars effective. And this is the lesson, this is what Africa asked for, started very nicely to build for the last 2 years. And I really want to commend again the performance of John and the African CDC playing this central role in the COVID response. Also the establishment of the Africa Medical Supply Platform, AMSP, the Africa Vaccine Acquisition Fund, AVAT, we are financing with many others now, after a bit of doubt at the start, but now everybody only applaud to what the African Union and Afreximbank did to speed up vaccination. I also commend the creation of the Africa Medicine Agency now. AfroScreen, the project we are financing to support capacity in sequencing, including monitoring COVID-19 variants in 13 countries in Africa, is part of this pillar. And now you see we have nearly all the elements of a complete and comprehensive and efficient African system. Of course, as part of a global response, we're very proud, for instance, of what we are doing with the Global Fund in DRC with African colleagues. And certainly we need to work on this articulation between global and regional and national. That's first. Second, to echo what I said at the beginning, we need to foster investments in Africa health systems very seriously. So we need an investment agenda. Of course, with Team Europe in the next few days taking the initiative and we're very proud that AFD is part of this European answer. You know, we launched this Health in Common initiative to, Stephanie was referring to, 2 billion euro for Africa for the next 2 years, nearly totally disbursed already, and 5 globally to fight COVID in all our partner countries. So we need to increase investment in the segments that are missing health workers and infrastructure, disperse and manage it very efficiently, of course, following the African leadership and to a large extent building on home ground capacities and domestic investments, as Peter said. Third, of course, it will not be only public. And so since this is a major economic sector and potential, we need to build a conducive investment climate to foster the growth of quality healthcare industry and leverage private sector investments in this regard. The COVID-19 crisis has shown that global markets for health products are profitable, but also that they have struggled with equitable access to health products, especially in Africa. So we need new enhanced industrial policies for healthcare.
We have lost you, Remy.
Can you hear me now?
Remy, we have lost you.
I'm here. Can you hear me?
Yes, we can hear you now. Yes, can hear you.
I was pushing for more private investments, also in the health sector. Of course, what we did in South Africa to support Aspen, again with our own private sector window, ProParco, but also with European colleagues as part of Team Europe, with IFC, with CDC, with USDFC, all the DFIs. And is I think important, as well as the technology transfer hub that was also placed in South Africa, and we certainly intend to expand this support and complement it with support to pharmaceutical regulatory agencies at regional and national level. This is the REC Pharma project. To unlock more private investments in the sector. I close by saying and plea for the useful role of African public development banks, both for the public investment side, both to provide comfort to the government in setting the right policies and explain that they will have impact. And also to de-risk and help foster private investments. And I'm very glad to announce again that the African Development Bank, you headed, Donald, together with the European Investment Bank, have accepted to host the 3rd edition of the Finance in Common movement next fall in Abidjan. Before COP27, before major events, before the conference for the global funds. And really, I think it will be an occasion gathering the more than 500 public development banks in the world, including 100 in Africa, to work on the best possible alignment and articulation between global messages, global multilateral capacities, and national systems, national investments. You know, there's a huge discussion ongoing. President Macron is, and I'm pretty sure will be insistent on this week. My own treasury is proposing to allocate channel SDR towards public banks, especially African one. This is what African shareholders did for Afrexim Bank, if I'm right. This is what the African Development Bank is proposing as a prescribed holder of SDR. If we succeed in building this capacity, if we fund it with innovative resources, can be SDR, can be other resources, of course, then we will have a very strong partnership, deeply rooted in Africa itself, with TDB, with Caisse des Dépôts et Gestion in Morocco, with BOAD, with DBSA, with all our friends. Of course, interacting, co-financing, sharing risks with all of us, and insisting, putting the focus on the health sector, which is the main priority right now. So I stop here. Thanks a lot, Donald and others.
Thank you very much, Remy, and thank you for your support and that of your country, France, to African institutions you have described during this period has been very, very appreciated. And at the EU summit, at the preparatory summit, which I attended in December, there was a lot of discussion about issues around the public development banks. And I think EIB and FDB will be explaining what they intend to do. But also how we can work together with Africa CDC and the Medicine Agency. And I look forward for that discussion again this week. But thank you, Remy, for what you have done during this period. Now, we're running out of time, but I'm keen to hear the next two speakers, which is Yakono from UNDP and then Igat. I apologize to colleagues, we're running out of time, but it's an important subject. We want to hear all of you. So our colleague from UNDP, Yakono.
Thank you. Can you see me?
I can see you now.
Okay, fantastic. Thank you so much, Donald. And dear colleagues, let me dig right into it. I couldn't really pass up an opportunity to contribute to this topic, however early it is here in my corner of the world. Health and wellness are at the heart of the development agenda, the SDGs, of course, and the Agenda 2063. So I've been asked to address the financing pathway to achieve SDG 3 on good health and well-being in Africa, and more broadly, how to ensure we change course on the SDGs to get on track. And to do this, let me first remind us of three key revelations emerging from this experience of the pandemic. The first is that health and health systems are a development issue. If we didn't know it before, I think now we have that wake-up call. The second is that money is important, but we must be highly selective about what we want this money to do and how it is invested in the direction of ensuring availability, accessibility, affordability, as well as quality services, and directing resources towards building resilient health systems that protect the dignity of all Africans, irrespective of where they were born, live, work, or who they are. And the third is that as money becomes available, we must ensure African institutions are empowered to own and lead the way. I just came back from the African Union Summit in Addis Ababa, and the tone of the leadership there was clear. COVID-19 is a major blow to hard-won development gains, and this makes more urgent the need to secure Africa's health capacity as a development priority. And this takes me to my first point on COVID-19 as one that has unveiled the reality that health systems and wellness are core to human and socioeconomic development. You know, the UN Secretary General was very quick in directing the UN system to look into the socioeconomic impact of the pandemic and support governments in developing response plans that address the health needs, but also the impact on the economy. And this led us really to work with governments and country teams on these socioeconomic impact assessments and recovery plans. We've done 40 recovery plans on the continent, which have all confirmed what we feared, which is that there is a deepening of the financing gap, shrinking of the fiscal space, coupled with rising public debt. It's really a perfect storm in slowing down the pace of our fight against inequality and extreme poverty. The financing pressure on already limited revenue pools is very high, and it's worsened by low taxes, especially at the time when other revenue streams from trade and investment are quite stretched. So this is unfolding in the middle of a continent-wide health financing gap that is at least $66 billion per annum in terms of the gap. We also know that Africa, in this continent, out-of-pocket expenditure dominates at 36.1% of current health expenditure, and health insurance sits at just 6.9%. There is hardly any cushion for the majority of the population. And because there is a very strong prevalence of out-of-pocket private expenditure, a sound recovery strategy is about creating ladders of opportunities for people towards resilient livelihoods. We need to conquer poverty in all its dimensions. And the push towards making Africa's money work for African development has never been more urgent. This is a continent with robust natural resources, but much of this natural endowment is not realized for the improvement of the lives of Africans, especially its youth. And I want to agree with the previous speaker that youth should be central in this conversation, both as beneficiaries and as actors. And we must therefore invest in health capacities as an urgent development priority. And we do this by ensuring that public health systems are fit for purpose, that they have the supplies they need, that they are well regulated in the public interest. And let us not forget that the right to health is a human right. The world in which we live now, of this gross inequality, is a scar on our common humanity. And it reflects a breakdown of civilization as we know it. This is an outrage, and we have to be concerned. While we must continue to push for global responsibility and solidarity for health as a public good, we are also in UNDP working with African governments and institutions to enhance domestic revenue mobilization through the Domestic Resource Mobilization Tax for SDG initiative. And this is to support taxation to improve health and well-being by doing three things. One, supporting the efforts of tax administrations on domestic tax compliance, including work on illicit financial flows in the health sector. Two, advancing health and development through taxes on health-harming products by proposing tax models that calculate, one, lives saved, two, productivity losses that are averted, and three, expected increases in revenue from tax increases on tobacco, for instance, on alcohol and other products such as sugar-sweetened drinks that are harmful for people's health. And three, support to enhancing national health financing as part of the integrated national financing frameworks, what we call the INFFs, which we have conducted in 22 African countries. Health taxes are included as a key mechanism for mobilizing domestic resources and also health-related priorities. And the aim here is to include this as part of the INFFs. For example, tax reforms, earmarking, etc., as part of a wider health reform campaign. But money alone is not the solution. It is important, but we have to, that's my second point, we have to invest and disburse resources in a way that we see the impact. And we are shock-proofing systems against pandemic events, or we are causing prevention at so many different levels. Africa has a chance to invest in systems and a culture of managing health rather than managing disease. We can learn from experiences in advanced countries which have really discovered the value of diagnostics, for instance, in preventing the onset of disease. and this will reduce the disease burden on health systems. COVID-19 has also shown us that Africa's very small industrial fabric and reliance on imports for medication, for equipment supply chains to the tune of 90% is a disaster. So we must target development financing towards building productive capacity across Africa's medical system, including the production of diagnostic equipment. The examples that we see in Senegal's Pasteur Institute and the steps being made by Rwanda, Mauritius, and other countries to produce vaccines on the continent are really exciting. Similarly, we must support the buying and selling of made in Africa goods through our own processes. And the AFCFTA, as revealed by a recent futures report that we authored with the Secretariat, offers new and dynamic opportunities for trade in both pharmaceuticals and vaccines. And the African healthcare sector is estimated to be worth a total of $259 billion by 2030, according to the World Economic Forum. And this is a huge opportunity for Africa's private sector to contribute through public-private partnerships. Regulation to protect consumers, including on pricing, will be a necessary ingredient for success. And it should never be just about big companies. And here at UNDP, we're prioritizing support to building the capacity of small-scale healthcare facilities and to improving their efficiency and access to finance through what we call the UNDP Solar for Health program. Here, we're also supporting the development of the AFCFTA regional value chains, especially for women and youth enterprises. We see in Mauritius, we're supporting the government to develop a new pharmaceutical hub, for instance. And we have the SDG Investors Map, which we have developed now in 8 countries to provide market intelligence to the private sector on investment opportunities that address development needs and contribute to national policy priorities. Among the 100+ African investment opportunities, healthcare is in the top 3 sectors. And this, I think, it's something that we should continue to accelerate. My final point is about the role of Pan-African institutions, the Africa CDC, which has already been mentioned, the African Union in general, and other Pan-African institutions like the Afreximbank. They have distinguished themselves as a class apart in leading the continent's response to the pandemic. And this should give us hope and also make us proud. A case in point is South Africa's ongoing production of vaccines under license, which increases availability on the continent and works to preserve the dignity of the African. And this should be celebrated, and the institutions that supported this, like Afreximbank, should be praised for their vision in seizing the moment to be present for Africa when needed in a practical and impactful way. So let me close by stressing that it will take greater international action and solidarity to get on a path to achieving SDG 3, which is key to achieving many other SDGs. Where are the low-hanging fruits that will also show this much-needed solidarity? I think that the IMF estimates that it will take $425 billion of additional external funding over the next 5 years to make it happen. Can we rechannel SDRs, for instance, to African governments to support health needs and help enable greener, more robust economic recoveries, while also promoting a more balanced, sustained, and inclusive global recovery? As the UN Secretary General often says, it is not charity, ladies and gentlemen. It is enlightened self-interest. We're all in this together. Thank you, and over back to you, Donald.
Thank you so much. Thank you for what you have said. Thank you for your leadership, and to the UN family as well. Now, colleagues, I had requested for 10 additional minutes from the organizers, and that then we granted. So I want to apologize for the next panel, but we have one more speaker, Yared, who want to listen to. But Yared, because you are the youngest of this team, but I ask you to be as concise as you can so that we can go on to the next conversation, please, with my apologies. You're right.
It's fine. I'll try my best. Firstly, I'd like to say I'm tremendously honored to have been invited to the AU-EU Summit to share this virtual stage with global leaders who've devoted their careers to improving the health of those in the greatest need, particularly in my home continent of Africa. And while I can't draw on the wealth of experience and knowledge of the speakers who preceded me and those who will follow, I can draw on my perspective as a young African. And in the next few minutes, I hope to advocate for the importance of investing in youth health. So I consider myself privileged to have been raised in Africa, both in Malawi and Zimbabwe. But the truth is, I sadly hesitate to say this around those who do not have the same privileged upbringing I was afforded. I sometimes wonder what would have happened at the times my siblings and I got malaria or pneumonia or broke our bones and all the other staples of an active African youth had we not been able to get quality healthcare. Would I still be so enthusiastic? My family and I might add many of the leaders of our continent, always know in the back of our minds that if we get too unwell, we'll be on the first flight out. And it goes without saying that this is not the case for the majority, not least the youth. And when we discuss health in Africa, we are inevitably discussing youth health. Just over 60% of sub-Saharan Africa's population is under 25. And this is compounded by the fact that several of the leading causes of mortality and disability continue to be conditions that disproportionately affect the young. And while infant and child health receive a large proportion of funding, adolescents are sometimes overlooked. Adolescence is a unique formative stage of life with all the cognitive and behavioral developments taking place, and they shape life, health in later stages of life. Some 19% of the world's adolescents live in Africa, where 45% of adolescent deaths occur. With HIV, for instance, adolescents have been among the few age groups that have experienced a rise in transmission. Additionally, studies have found that mental health problems like suicide, depression are occurring at higher rates than those seen in high-income countries among African youth. However, it is important to remind ourselves that investing in health is a political decision, and that contrary to some of the low prioritization reflected by our domestic health budgets, health is an investment, and this is doubly true for youth health. I would argue that Africa's youth can be its greatest asset, and accessible quality healthcare is the foundation upon which to enable youth to flourish. The tremendous progress in improving health outcomes in Africa's youth, particularly in malaria and HIV, has been on the back of increased prioritization and funding of health. But there's so much to be done if Africa is to achieve its targets of universal health coverage by 2030. In order to achieve these targets, we can no longer treat healthcare spending as an afterthought or simply the remit of development partners. Insufficient and inefficient healthcare spending means young boys and girls have poor educational attainment, are pushed into poverty or further into poverty, deepening the chasm between those who can and can't access healthcare, and it perpetuates a vicious cycle of intergenerational poverty. With so much of their lives ahead of them, it is only just to invest in the youth's education and protect them from the financial burden of healthcare costs, as they are, after all, tomorrow's community leaders, policymakers, and peacemakers. For those more convinced by the economic appeal to health, I would remind them that the youth is the economy's fuel. They are the next decade's tax base, and providing them with quality healthcare will facilitate their social mobility. There are, however, reasons to be optimistic about youth prospects. The WHO estimates that in low and middle income countries, 85% of the costs of meeting sustainable development goals and targets can be met with domestic health financing. The African Union has recommitted itself to increase investments through the ALM declaration. There's also much to be learned from several African success stories in healthcare reform, the introductions of social insurance to innovative taxation for health, to pooled procurement and institutionalization of evidence-based priority assessing. Additionally, we have witnessed the strength of African response to the pandemic through the development of numerous platforms, including Africa CDC, and against the backdrop of a disheartening international response. And as the saying goes, a rising tide lifts all boats. And by this, I mean that a robust, sustainable healthcare system will benefit those of all ages, and it can be achieved. Finally, I would like to say that African healthcare is in African leaders' hands, and today's youth depend on their strong leadership. The pandemic has been a stark reminder that reliance on external funds is an untenable position for national healthcare systems to be in. And it is also important to remember that we can't allow the COVID-19 pandemic to be yet another anchor on economic growth and for youth prospects like HIV and malaria have become. Given the fiscal constraints that several African countries face as a result of the pandemic, countries will need to support to navigate the challenging health financing landscape ahead. So we, the youth, would ask the leaders here at this summit to support a successful global fund replenishment this year to enable youth to their right to health and all its associated benefits. Thank you again for the opportunity to speak and for giving the youth a voice. I return the floor to you, Dr. Kabruke.
Thank you very much. Struggling with the system is muting me out, but I hope you can hear me. Look, I want to thank you for what you have said and for what you do. I have not much to add, except to say that at the turn of the millennium, the world came together in the context of the MDGs, and wonderful things were done, including the Global Fund for AIDS, Gavi, and so many other wonderful institutions. This time around, Africans themselves have come up with excellent institutions. And I think we have all learned lessons of what we can do in the future to make sure we're better prepared. It can't be lack of money. Just think about the counterfactual. If we fail to find the resources necessary for preparing for future pandemics and link back to the economic crisis we have just gone through, the impact of lack of preparedness. So we can raise the resources globally. We'll have to demonstrate how to spend them well. And I think, as someone said, we're in this together. So thank you for your contributions. Thank you for what you do and what you have done. I will now hand over to the next panel, where we shall hear very distinguished panelists telling us exactly how this can be taken further. So thank you, Winnie. Thank you, Peter. Thank you, Stephanie. Thank you, Yared. Thank you, my colleague, Zepono. Thank you, Remirio. God bless you all and see you next time. I hand over to the next panel.
Thank you, Donald. Bye-bye.
Thank you. Thank you, Dr. Kabruke, and thanks to all those fabulous speakers. I don't know if you can see me. I'll introduce myself very quickly. Maybe I should go there. 1 minute, please. We're changing. This shirt of mine. Hello, everybody. So we are going to move to our second panel right away. It's been an amazing first panel. We are so proud to have all these fabulous co-sponsors and partners joining us for this session. I don't want to make long introductions. There's this sense of unity, and this working together towards shared objectives is what brought us to think about this session with WHO, with UNDP, with the sponsorship of the African Union, with the massive role of the Global Fund, with the government of France. So thanks to everyone that has joined this session. I want to move very quickly to this second session, and I want to explain how it's going to run. We are going to have first our high-level speaker, Dr. John Nkengasong. He has been praised already a number of times in the past session, so he doesn't really need a very long introduction. Africa CDC current director. He has been leading during this very difficult period, and he will tell us about where he sees this African leadership as we move forward. We'll then go into a dialogue with Krzysztof Kurowski. He will present the hard facts that the World Bank has been diving into, and the forecast and the prospects on where the health investment is heading. Then we'll move to listen to Joe Kutzin and bring his thoughts from WHO on how pandemics preparedness and what we do need to move towards the best possible pandemic preparedness. And then we will continue with our civil society speaker, Denise Namburete. That would be the first part of the session. The second part will be speaking with the European Union and the African Union that will bring us to conclusion. So that's the menu now, and I'm going to hand it over directly to Dr. John Nkengasong. It's an honor for us, and we are very happy to be able to listen to you. Dr. Nkengasong, the floor is yours.
Thank you so much. And let me, first of all, truly appreciate the quality of the conversation that I've been part of since I joined the discussion. And because of time, I would keep my comments to three. First of all, today, February 14, marks exactly 2 years that COVID was reported in Africa. The first 2 cases of COVID-19 were reported in Egypt on February 14. I start there because after that, immediately following that report, 1 week later, the leadership of the African Union convened an emergency meeting of all ministers of health in Addis Ababa. I recall that when Chairperson Faki was convening that meeting, people came to me and said, why would you convene ministers together in Addis Ababa in 1 week? It has never happened, and nobody will show up and it will be a failure. Guess what? Most ministers, about 46 out of the 55 ministers came, including those who were traveling. I imagine the Minister of Health of Nigeria was in Europe, had to reroute and return to Addis Ababa, and we had dinner that evening at home. So for that first point, I really want to emphasize that as we move forward, let's value and recognize the power of political leadership. Political leadership has played an enormous role in the way the continent has responded to COVID-19, both that from the Commission and from the African Union, led by the chairperson of the Union at that time, President Cyril Ramaphosa, who continues to be the champion to today, and has been, in my view, done a fantastic job. I usually characterize his leadership as hands-on exceptional leadership. During his tenure as the chair of the African Union, he convened bureau meetings about 14 times to discuss COVID and discuss that with the Africa CDC. I think that is a clear opportunity for all of us to begin to place public health at the highest leadership of the continent. And I'll come back to that shortly. My second message is that based on the 2 years experience, we've concluded that global health security for humanity, at least as far as Africa is concerned, means Africa has to strengthen its health sovereignty. So global health security, the pathway to achieving our global health security is to strengthen Africa and support it to achieve its health sovereignty, what we are calling a new public health order. That means we have to manufacture what we characterize as health security commodities, i.e. vaccines, diagnostics, and therapeutics, strengthen our workforce, strengthen national institutions, and mobilize domestic investment. Those are the key ingredients, colleagues, that will allow and enable Africa to achieve health sovereignty, which ultimately will guarantee global health security. I'm very pleased that Remy, in his interventions, remarks, recognized the valuable importance of looking at our collective security at 3 levels: the national, regional, and global. And at times the discussions are not as surprising, because things that happen at the regional level are at times ignored, and unfortunately so. We have seen during this crisis that the power of regionalism, and some of those have been discussed. I will now not repeat them, but we've also seen the limits of multilateralism, where once faced with a common threat, how quickly countries can fall back within their boundaries, ignoring that the pandemic is global. My last comment is really what has emerged recently, just last week from the African Union Summit. That was the first time in 2 years that head of states were gathering in Addis Ababa to discuss COVID-19. And a series of important decisions were reached, which I believe will inform this discussion. Again, in the spirit of strengthening regional health security, the leadership of the continent unanimously agreed to elevate the status of Africa CDC to a public health agency of the continent, and giving the director new status, which will now be a director general with the overall power to manage activities within that. I start with that because it's so fundamental to the discussion we are having, that regional architectures that are strong and empowered will lead to global health architectures globally. The second thing that emerged from that meeting is really the decision by the head of states to set up the African Epidemic Fund, a fund that will mobilize resources and use them collectively, because they have seen the power of collectivity when they established a joint continental strategy. I think that is extremely important that we listen to that. Then thirdly and lastly, out of the whole list of things that came out from that, is the establishment of the African Workforce Task Team that President Ramaphosa presented and his peers agreed on. So in the coming days, you'll be hearing very engaged conversations to discuss workforce development for the continent. Let me just conclude by saying that if you ask me what would be the most important lesson that we should learn from the 2 years here, is the ability to, or the need for all of us to try to listen to each other. Listen to regional aspirations, listen to regional platforms that have been put in place to respond to the regional needs, and which, if supported appropriately, will feed into the collective global mechanisms to fight this pandemic and subsequent pandemics. Examples I'm thinking of are those cited by Remy, the AVAD, the African Medicine Supply Platform, and there are about 12 initiatives that were launched regionally and very, very effectively have contributed to the fight against this pandemic, but must be recognized at global level, discussed at global level, and supported appropriately at global level. Thank you.
Thank you very much, Dr. Nkengasong. It's for your fantastic presentation and for your messages back to where the situation and where the conversation should be heading. Now we are moving to our second speaker, Krzysztof Kurowski. He's the global lead for health financing of one of UNAIDS co-sponsors, one of the co-sponsors of this session, and a very valued ally and friend. So Krzysztof, I'm inviting you to share with us the latest findings, the latest numbers, and your reflections. You are bringing to us a presentation with some of the key facts. So I'm going to hand it over to you. If you need support with the presentation, you can just use the next slide keyword to get some help from our colleagues. So over to you.
Thank you very much, Jaime, for the opportunity to set the stage for this panel discussion. Let me start by stressing again, and please show the next slide already, that an inclusive and sustainable recovery hinges on resolving the global health crisis. So in the next slide, you will see that this in turn requires three things. First, end the pandemic. Second, prevent future health crises. And finally, regain losses in coverage with non-COVID-19 essential health services. For such a resilient recovery, increases in health spending are critical. IMF and our World Bank projections, however, show large disparities in the ability of countries to build out key public investment. As you see in the next slide, in Africa, there's a group of 24 countries with an expected substantial expansion of general government per capita spending between 2019 and 2026. This outlook is favorable, yet not without challenges. For example, these countries are expected to go on average through 1 year of cuts in general government per capita spending. Then there's a group of 8 countries with an expected stagnation or sluggish growth in general government per capita spending. For this class of countries, the outlook is troublesome. They're expected to reduce general government per capita spending on average in 2 out of the next 5 years. And finally, there's a group of 19 countries where general government per capita spending is expected to contract and remain below pre-COVID-19 levels in 2026. For this group of countries, the ability to build out key public investments will be highly constrained. The countries are expected to cut general government per capita spending on average in roughly 4 out of the next 5 years. So how will these different fiscal outlooks impact government spending on health? Let's have a look at the next slide that illustrates the general dynamics using the example of lower middle income countries in Africa. If governments of countries belonging to the stagnation group hold the share of health constant, the scenario shown here in blue, per capita government health spending will on average only slightly increase from $56 per capita in 2019 to $62 per capita in 2026. In contrast, if pre-COVID-19 spending trends prevail, shown in orange, it will substantially grow from $56 per capita in 2019 to $78 per capita in 2026. In the contraction group, the difference between the two paths is substantially larger. If governments hold the share of health constant, per capita government health spending will on average decrease from $68 per capita in 2019 to $55 per capita in 2026. In contrast, if pre-COVID-19 spending trends prevail, shown in orange again, it will substantially grow from $68 per capita in 2019 to $103 per capita in 2026. In sum, if governments hold the share of health and spending constant, per capita health expenditure levels will in many places fall far short of pre-COVID-19 trends. This raises the question of what it will take for governments to return to pre-COVID growth trends in per capita health spending. The next slide illustrates the challenge, staying with the example of lower middle income countries. Among countries belonging to the stagnation group, the necessary increases in the priority given to health are substantial. The average increase is from 85 percentage points in 2019 to 10.9 percentage points in 2026. Are these increases feasible? They will certainly require bold decisions, especially in years where the overall government spending envelope is expected to shrink. Among the countries belonging to the contraction group, the necessary increase in the priority given to health are far larger. Indeed, a return to pre-COVID-19 spending trends will require more than doubling the share of government spending going to health, from roughly 9 percentage points in 2019 to 20 percentage points in 2026. Are such increases feasible? The truth is that in the past, we have not seen increase of this magnitude over such relatively short periods of time. Against this background, it is worrisome that in some African countries, the priority to health in central government budgets is not increasing, but actually dropping. The next slide shows most recent trends in central government budgets from 31 African countries, comparing allocations to health with overall budget envelopes. These are budget, not actual spending data, and have to be interpreted with caution. Yet in 18 out of the 31 countries, the share of health in the overall budget has dropped between 2019 and 2022. These are countries below the 45-degree line. More than half of them belong to the stagnation and contraction group. That is, general government spending is expected to flatline or decline between 2019 and 2026. The outlook for these countries seems precarious. Health has been deprioritized in central government budgets, while overall government resource envelopes are expected to stagnate or to shrink. And indeed, in some of these countries, those below the x-axis, central government budgets for health have already dropped below pre-COVID-19 levels. In sum, and this takes me to the next slide, without bold government action, many African countries will not mobilize the funding that is necessary to resolve the current health crisis. The likely outcome will be sluggish progress in the vaccination rollout, little improvements in health security, and at best stagnation on the road to the health SDGs. Such an outcome would pose grave risks to an inclusive and sustained recovery in Africa and in the world. This scenario, however, is not inevitable. Countries, as you will see in the next slide, can draw on a broad range of policy options to increase government spending on health and use it more efficiently and equitably. The good news is that countries have successfully deployed these policies during past economic crises. And some of these policies do not only benefit the sector, but can contribute to fiscal health more broadly. In our work from double shock to double recovery, we summarize these options, and many of them will certainly be discussed in this panel. In addition to domestic efforts, development assistance for health will be critical to bridge the widening rifts in health spending. As shown in the next slide, the most recent trends are encouraging. After a decade of stagnation, net commitments of multilaterals have increased from 9 billion in 2019 to 24 billion in 2021. However, we all know important funding gaps remain to overcome the current health crisis, let alone to accelerate progress towards the health SDGs. Therefore, it will be critical that development assistance for health remains on a growth path beyond the immediate crisis and despite the fact that many high-income countries are expected to also see little growth in their levels of government spending. At the same time, we as development partners must double down on our efforts to better align funding and support to help countries mobilize domestic resources and spend them more equitably and efficiently. As the multilateral task force on COVID-19 has stressed, the time for action is now. The course of the pandemic and the health of the world are at stake. And with that, also sustained and inclusive economic recovery. Thanks so much, Jaime.
Thank you very much, Christoph. Really, the numbers are telling, and I think it's very important that we speak to this agenda and to the challenges ahead, taking all this into account, as these are the basis for what we need to head towards. And thanks for that fantastic presentation, Christoph. I am moving now to introduce Joe Kutzin, that is the head of the health financing at the WHO. He will speak to the topic of preparing and responding to pandemics. It will be really central in these next years. And I just want to ask him about what the key elements of a sustainable path for pandemics preparedness and response would look like. Joe, the floor is yours.
Thanks, Jaime, and I really just want to express my appreciation to have the chance to be part of this distinguished panel. I'll also try to be what for me is unusually brief and trying to reinforce some of the key messages of previous speakers. On this question of what would a sustainable approach to preparedness and response look like, I like to start in this way because it's really important to get this question right, which is, what is it exactly that countries are trying to sustain, right? So in this case, it's about preparedness and response capabilities in service of the goal of health security while concurrently sustaining progress towards UHC, right? So in terms of resources, sustainability requires that we look not only at revenues, but also at expenditures. But too often, these discussions tend to come down to a focus only on revenues, how to get more money, how large is the gap to fill, and so on. And while words are often applied to to the importance of efficiency, we don't really speak to it enough. One of the core messages that we've always given on health financing for UHC is that we say, you can't just spend your way to UHC. And we think the same holds true for the goal of health security. Now, there's no doubt that in low and lower middle income countries, more resources are needed. And we heard earlier about some of the critical issues that have to happen in terms of improving domestic tax systems, cracking down on tax evasion, and increasing health and environment taxes as well. And I would put those together, as well as cutting inefficient subsidies, especially fuel subsidies. These are critical, as are some of the issues that Christoph's just raised around prioritization, right? But we have to deploy, whatever the resources are, we have to deploy these resources wisely, given the fiscal outlook for the coming years. And one of the messages, really the core message of what I'm going to say, is ultimately to do this, we need to have one health system with multiple objectives, rather than a different system for each objective that we have. And so we also need to, in doing that, we need to recognize that health system strengthening is not simply a matter of investment. We have to organize better to maximize results for our populations from the resources that will be available. So in this sense, sustainability is really a system level issue. And indeed, given that it's going to take multi-sectoral action as well, it could be seen as a whole of government issue. And from a fiscal perspective, that really means looking at this challenge through the eyes of the finance minister. So this means that for us in the health sector, we have to promote a smarter and more systematic approach to fund and organize what we're calling the health commons at national and global levels and regional levels, as we heard. We have to do that in a more intelligent way than how we've done things in the past. We have to invest in the right things. We need to strengthen domestic and regional institutions. And we also have to avoid some of the wasteful practices that have characterized the response to health priorities in the past. So I'm just going to speak to this issue of the how and how to learn from the past for the purpose of the discussion of sustainability. Really at the core of this is something really simple, which is to separate ends and means in public policy. And it sounds simple, but very much in the past, we have conflated ends and means due to the urgency or importance of the issue at hand, and whether that was responding to HIV, TB, malaria, or other emerging priorities. So it made a lot of sense, and it continues to do so, to think about disease-specific approaches to global fundraising, and this is certainly going to be the case, again, with pandemic preparedness. But what we need to avoid is to kind of translate the architecture of global fundraising into domestic health financing arrangements. These are very different things, right? So within a domestic system, having a separate arrangement for managing funds, organizing information, sometimes even delivering services, is not going to lead to an efficient use of resources across the system, even if individual programs are well run. Now, in saying this, I just want to be clear, this is not a criticism of any other agency. And I would be the first to say that WHO was organized in this program by program manner long before many of our partner agencies here even existed, right? So this is not something that is new. But as we move forward together on pandemic preparedness, we need to learn from the past and do things differently if we're not only to initiate action, but to sustain it over time. Now, what does that mean in practice? It means recognizing that the same health workers who deliver services to patients also have a role to play in contributing to preparedness and response. It means organizing laboratories and the surveillance function on a population basis rather than program by program. It means enabling data systems on patient activity to be linked and to speak to each other rather than being fragmented according to health financing scheme or health program. And given the multi-sectoral nature of what's needed, it means setting clear objectives that different sectors pursue jointly, often requiring new approaches to multi-sectoral budgeting. And last, it really means that we don't only focus on short-term results, but as many people have said here previously, also on strengthening domestic institutions to sustain the gains over time and enable systems to be more adaptable to future challenges over the long term. Indeed, COVID has shown us that we can't sacrifice institutional development for short-term gain. The health, social, and economic consequences have been too great. And it is worth reflecting a bit on the fact that we're here now in this place, despite the billions that have been put into global health over the past 20 years. So to summarize, it really means that within the domestic public sector architecture, financing for preparedness and response should not be organized in a vertical way, but rather flow to a set of cross-cutting functions organized on a system-wide and population-wide basis, for example, with disease surveillance. So as I said, in my last words, are that achieving health security and sustaining progress towards UHC demands that countries have one health system that serves both goals. Thanks very much.
Thanks very much, Joe, and thanks for bringing forward what you want to set out as the agenda for these pandemics, preparedness and response. It's a very hot agenda, and obviously it's one of the things we're going to be talking and working around in the next years as a community around health financing. So this is a very important contribution. I'm going to head next to a civil society voice in our session, a leader from Mozambique, Denise Namburete. She's the executive director of Enweti Health Communications. And I wanted to ask her about precisely that civil society agenda for universal healthcare and about the concerns around the burden of debt on African economies and how that interacts with health challenges. So Denise, the floor is yours.
Thank you very much, Jamie, for having me and for your questions. I think that, I will make some of the remarks have been raised already. I think I'll talk to those issues. I think that financing universal health care cannot be separated from broader fiscal policy challenges in emerging and developing countries. in low-income countries with significant fiscal constraints, the overall fiscal framework is a central challenge for universal health care. So some of the solutions that we have been discussing as civil society include, I'll raise just a few. And we had today from previous speakers how domestic resource mobilization is central. So I think that must be supplemented by measures to improve efficiency in government expenditure programs. I think in the absence of public sector efficiency, there is a high risk of tax revolt, especially in the global South countries. The second aspect is related to the fiscal space, increasing the fiscal space for health and education, but with sustainability and accountability. I agree with the ideas of the health taxes to increase domestic mobilization. We talk about efficiency improvements, public financial reforms as currently advised. Will only, I think, mobilize limited resources. They will not be enough to support countries to cope with their health needs not for sustainable health system development in the long term. So I think that international financial institutions, donor institutions, initiatives in the health sector, as well as donor governments, should support and fund accountability work to prevent the loss of huge amounts of money due to illicit financial flows amounting to approximately $500 billion annually worldwide. There is also a need, I think, for cross-value chain financing in healthcare. A strong primary healthcare system is a precondition for stable secondary and tertiary sectors. So as much as tertiary hospitals are important, but I don't think it can leapfrog underdeveloped primary health systems. And that actually goes along, I think, with a broader access to social infrastructure, which is also important. For instance, access to water and sanitation has a direct impact on health outcomes. So backward integration seems to be very important. In concrete terms, I think there's a lot that can be done with existing global health mechanisms. And I'm talking about the 3 Gs, the Gavi, GFF, and Global Fund, which alignment will be very beneficial to African countries to enhance impact and increase efficiency of their respective activities, which is much needed. So strong and well-functioning health systems that can ensure universal health care that can benefit youth can only be achieved through sufficient, sustained, and aligned investment from domestic and external resources. So the alignment of the 3 Gs, which is already reflected in a global action plan for healthy lives and well-being, is yet to be seen in countries. And I think it's something that can move faster. And finally, in terms of the solutions, I think that support to governments to increase investments and ensure equitable distribution of their workforce can be very important. So financial support packages from bilateral and multilateral donors, as we know, do not specifically prioritize the urgent need to recruit additional health and education personnel. Especially when it comes to improve remuneration, working conditions, retention packages. But there is an opportunity which is related to the IMF. I believe that conditionalities from the IMF for recruitment of health and education staff limits the ability of governments to provide for their populations. And I think this needs to be looked at very carefully. So in terms of the risks of debt growing and what action should be taken to protect health in our African countries, I believe that donor governments can cancel bilateral and multilateral debt payment obligations. Notably, 46 countries in the world were spending more resources on public debt service than on their health systems in 2018. So addressing this would allow African countries to recover from high losses on their government budgets and get the opportunity to increase their fiscal space and invest in sustainable social sector systems, including health. And another contribution, I think, is in relation to the role of the international financial institutions that I believe that could refrain from policies and conditionality that contain countries' ability to spend on public health, especially. So I believe that health and social expenditure should be non-negotiable. They should not form part of fiscal consolidation programs, given the deep needs from the population. And the fact that all IMF programs, what I mean is that they should be insulated, the IMF programs should insulate the poor. This should be the new narrative that informs countries' abilities to increase their domestic resources for health and should be supported. I would like to conclude and say that I like the idea of an investment agenda for health financing raised by Remy. And I think that different ways of creating for creating fiscal space for health should not be regarded as independent of each other, but rather be employed together. Thank you, Jamie.
Thank you very much, Denise, for bringing forward a civil society agenda for action that is so relevant to the time we are speaking, and to speak about the protection of social sectors, the protection of health, education, and these other things that may come or will come under further stress, even beyond what Christophe has presented in his great presentation earlier today. And we're moving now, and thanks everybody for trying to move smoothly ahead. And again, I apologize for being late, and my gratefulness for your patience. We are moving to our last section of the meeting. We want to speak, of course, there is an African Union, European Union summit these days that is so important, and that partnership, that new partnership, this new station is going to be very important, and we are really pleased to welcome now the Deputy Director General of the European Commission, Mr. Martin Seychelles. He focuses on the role of the EU and the strategic partnerships with the African Union. We are going to ask him about two related things, and I'm taking the opportunity of bringing some of the other issues that have come up in the session. So we wanted to see how can the EU be the most active partner and ensure that the fight against AIDS remains central as we boost health systems and pandemic preparedness investments. And then, although we know, of course, that the European Commission does not have a direct role on SDR reallocation, we have heard it come again and again in this session and in other moments. So is there some thinking coming from the European Commission on how this could be an option for European countries, European member states, and how to push that forward? Mr. Seychelles, the floor is yours, and thanks.
Yes, thank you, Jaime, and thank you also for giving this opportunity. Let me start by recalling the speech given by President von der Leyen at the launch of the EU Comprehensive Strategy with Africa in March of last year, where she stressed that Africa was the EU's natural partner and neighbor. And of course, as partners and neighbors, we are observing with great interest the very positive evolution of the health institutions of the African Union. And we also appreciate the many similarities between our two architectures. As has been said before, I think in a very bleak overall picture, one of the bright spots which has emerged in recent months and years has been the growing strong African leadership on the issues we have just been hearing about. And there have been many bold and strong decisions taken. I just want to highlight three, which particularly resonated with us in Europe. First, I'd like to take this opportunity to celebrate the decision of the African Union last week to elevate its African Centers for Disease Control and Prevention, the African CDC, to the status of an autonomous public health agency for the continent. I think this is a reflection of the very strong, effective leadership the African CDC has really, in the first few years of existence, already demonstrated. And it is emerged already as a key institution for the health security, not just of Africa, but also of its neighbors, including Europe. And also it has led energetically the response to the COVID-19 pandemic in Africa. The African CDC is indeed a strong partner for our European CDC, Both organizations have taken similar choices. They face similar institutional challenges. And I'm confident that the new status of the African CDC will facilitate not only its delivery, but also its interaction with us in Europe. Second decision also taken in the African Union is the establishment of the African Medicines Agency. And with the treaty coming into force just a few months ago, the AMA provides a new horizon to improving access to quality medical products on the continent. It will greatly, we are confident, equally facilitate the development of an African pharmaceutical industry that would contribute to making pharmaceutical production more equitable and more resilient at the global level, and indeed would address some of the blatant access inequities that the COVID pandemic has evidenced. And indeed, a number of our national regulatory authorities of our member states are already working as Team Europe with their counterparts in Rwanda and Senegal, other places as well, while our regional initiative on supporting the manufacturing of vaccines, medicines, and medical technologies in Africa will accompany the first steps of the African Medicines Agency. Now, similarly, as with the collaboration between the ECDC and the African CDC, our European Medicines Agency is also prepared to become a long-standing partner of the African Medicines Agency. Thirdly, just a few days ago, we heard that President Ramaphosa, one of the leaders of Africa's response to COVID-19, propose the creation of an AU Pandemic Preparedness and Response Authority, with functions which in many respects also mirror the conclusions we had ourselves drawn in Europe during this pandemic, and which led to the establishment of the HERA. And I mentioned these 3 points because they show that Africa and Europe, whereas of course we are often tackling very different situations, but we have identified a very similar strategy towards addressing these challenges. And this leads us to the obvious conclusion that there can be a very strong and valuable partnership between an African health union and a European health union. I think the pandemic has shown, if we needed any evidence of that, just how critical health is in our societies. So what should this collaboration between the EU and the AU on health look like? Well, first of all, clearly we are addressing the key issues, namely the strengthening of health systems and health security and preparedness. And in practice, what this means is that there is a lot of scope to work together to address structural areas, to work on improving universal health coverage, preparedness and response to health threats. And this means in practice that we need to initiate, expand partnerships between our respective health organizations at all levels, leveraging scientific, technical, academic expertise from our 2 continents, and expanding collaboration with global health agencies and initiatives. It also entails, such a partnership would also entail engaging on an ongoing strategic dialogue on various policy matters between European and African institutions, particularly when it comes to the governance, integration, and domestic financing of regional and continental organizations and networks dedicated to health security. This is an ongoing task. So we'll need to also make sure that all these efforts are not just put into place, but are sustainable also in the long term. We also need to tackle other issues as well. One issue which has not maybe been mentioned so far, but which is critically important, is how to work towards the defragmentation of health products market to really bring out the full potential, the undeniable full potential of Africa as a growing market, and the implementation of the much needed continental and regional policy frameworks that would strengthen public health capacity. The pandemic has shown us that health systems critically underpin our entire economies, and I think that's a lesson that we all have learned in many ways. And of course, there's the obvious parts, the frontline health workers, but also behind them, a whole panoply of essential categories, which we realized only during the pandemic how critical they were. The pharmacists who watch the quality of medicines, the logistics sector, which ensures that commodities are there when needed, all those involved in creating and producing medicines. And This is important because from an economic point of view, this is also an important source of jobs for Africa as it is for Europe. And which brings me to the topic of health financing, because all this is the potential. How do you bring it out? How do you convert this into reality? And I think the bottom line, as has already been said, is that a durable improvement of public health in Africa can only happen if African governments invest more consistently, in their health systems. I mentioned consistency because we know that investment in health is a long-term effort. It has to be sustained in the long term. So this is an important objective. But of course, this is where the regional structures come in, because our experience in Europe has been precisely the same. The bulk of the work, of course, has to happen at national level, because that's where health systems are anchored. But those national efforts can be greatly supported and facilitated by being able to rely on strong regional institutions, which is why I think there is, I mentioned the similar strategy that Africa and Europe are adopting in this regard. Now, health spending in African countries, we know, is financed primarily from out-of-pocket spending and external aid. We see, of course, negative developments. According to WHO, the share of health in government spending declined in low-income countries between 2000 and 2011, before partially rebounding and stabilizing in recent years. But now we have COVID. And whereas, external health aid rose considerably over the past 2 decades, in countries which were highly dependent on external aid, health priority in government spending fell in line with the increased aid. So instead of inducing additionality, unfortunately, external aid induced some governments to further prioritize other sectors. We understand, of course, that other sectors may also be and are very important. But as has been said already, we need to work together to ensure that health as a sector is also strongly prioritized. And this is not just an issue for health ministers, far from it. This requires political prioritization and, as I said before, sustained commitment. And this is where we in Europe see a lot of scope to work together with Africa. We face exactly the same challenge, how to consistently prioritize health among many other priorities. And to do that, we know also that we have to work beyond the confines of the health system. Increasing domestic resource mobilization requires, for example, supporting public financial management, requires work together to expand tax revenue, institution building, budget management, etc. So I think there is ample scope for a reinforced EU-AU partnership in health. We are very much committed as Team Europe to working with our African friends and colleagues in not just in supporting their efforts, but also globally. We are committed to working with them to strengthen capacity for preparedness, to strengthen the building blocks of the health systems. As has been rightly said, it is there that we need to be much better prepared for the future and to also deal with ongoing challenges, and to support the establishment of universal social protection floors. Very briefly, to come on the issue which you mentioned on the special drawing rights. Clearly, of course, this is something which is obviously very much under discussion at the moment in Europe. Just recall that so far 6 member states of the EU have already pledged to reallocate part of their SDRs for a total of 13 billion, but we know that much more needs to be done, and we are working very much on that. The EU is, as are all IMF members, looking forward to the establishment of the Resilience and Sustainability Trust at the IMF, which will be one of the 2 mechanisms of the IMF to channel SDRs. There is also, of course, a third option through multilateral banks, which could be also further developed. And we know there is work ongoing on that as well. But really, I think the next step will be to really put in place all the 2 IMF mechanisms, particularly the Resilience and Sustainability Trust. This is particularly important for us in the EU, to also, because of rules that we have at ECB level, etc., that the SDRs need to maintain their liquid asset nature. But we are confident that also the discussions that will be underway this week will help us find a way forward, and we certainly acknowledge that this is a top priority for Africa and that we need to do our part as well to support. Thank you.
Thank you very much, Mr. Seychelles, and thanks for responding to those questions and for setting the tone for that partnership and for that growing partnership on HIV, health and pandemics, on all this field that is going to be so important in the next years. We are struggling with connection, and we are not sure that we are going to be able to have with us the African Union. It was going to be Dr. Margaret Agama Ai, Director of the Department of Health, Humanitarian Affairs and Social Development, that was going to join, but there are problems with the line from Addis Abeba. So I'm just checking with my colleagues if we are finally having her. We know she's been joining and been on and off, but it seems that we don't have her at this point, because the whole idea is that the African Union had the last word of the session to bring forward the views and the vision of African Union, of course, in this very important moment. Let me check, make a final check, because it doesn't seem to be working. No, she's not on. So this is a real pity. We will find a way of bringing forward the African Union's views of this session. We had worked on a summary outcome for the session, and we wanted, it was the African Union that was going to handle that, but we will share that after the session. I think it's better to conclude now, having had these many amazing presentations. I can only thank everyone, the first session, the second session. The first ones were already thanked by Dr. Kaberuka. I want to thank Dr. Nkenga Song, Dr. Kurowski, Joe Kutsin, Denise Namburete, and Mr. Martin Seychelles for their contributions. Say that it's a pleasure for all the co-sponsors in this session to work jointly with this unity of action on the need for better health and for dealing with current pandemics. That's important, and with future pandemics. We cannot jump into the future without dealing with the present, and that's something that we need to bear in mind with AIDS and COVID these days. So I just want to leave this as a final message. Thank everyone and say that we will share after the session. I don't want to speak on behalf of African Union, of course, this draft summary outcome of the session, where we had 3 points: how overcoming the COVID crisis speaks to financing for health systems and investing to end current and prevent future pandemics. A second point on the relevance of African leadership and sovereignty with multilateral support towards a new partnership with Europe. And third point, a path for increased domestic financing with international support and growing solidarity at a critical time. Those were the 3 summary points that we had started talking about with all the co-sponsors of this session that I want to mention once again: World Bank, UNDP, WHO, of course, the African Union, of course, the government of France that was hosting us, and UNDP, I don't know if I mentioned again, but it's never too much. And the Global Fund, of course, sorry, yes, we had the CEO of the Global Fund, and we've collaborated very closely with them. And as you know, we are supporting and very strongly supporting this new replenishment. So let me stop here, thanking everyone once again, and letting you all know that we'll share new materials on this. And we expect to continue this as an ongoing conversation and to keep working together with all these fantastic partners, allies, and friends. So thanks everyone, and goodbye.